Now, if you can hear, let me know. We need to talk about this. Let's talk, let's talk, let's talk. Let me know as soon as you join in where you're watching from. I expect more Nigerians to join this live, and then, of course, people from other parts of the world, different parts of the world. Of course, Nigerians are in different parts of the world, but sometimes people within the country tend to probably take more interest than those who are outside the country. So, how does this affect you? Let's have a chat on the hidden health crisis. It's hidden, so let's see how much of it we can find out and then talk about. Welcome to the live. Just let me know as soon as you join in where you're watching from. And are you a Nigerian? Even if you are not a Nigerian, there is the need to also be well informed about what's going on and how that relates with you, or how that relates to your own world. Let's talk. In the news recently, we've had a lot of tempers generated, a lot of attention drawn to the statement by the United States president talking about invading Nigeria's is it war zone area now, or we call it areas of tension. Nigeria has called attention to the world. Generally, people are talking about this and different opinions. People believe that there's a political agenda. Some people believe that it's just time for some major things to happen regarding insecurity in Nigeria. We talk about politics, we talk about insecurity, we talk a lot about the social happenings, events, what's in the news, we talk about sports. So how much time and attention do we actually give to health? Interestingly, everything is connected, and I like to let you know that many things are connected. We cannot separate politics from health. We cannot separate health from politics. Security is also related to health. Health is related to security. Okay. So, but a lot of emotional expressions have been displayed, people talking from different points of their understanding, their background, their prejudices about the politics and the security states in Nigeria. Okay, so but why do we why should we ignore the facts? Why should we deny the facts instead of facing the facts? And that's one thing that happens with health matters. People tend to ignore symptoms. People tend to ignore the signs. Okay, instead of just ignoring, we should be taking action and taking steps and the right steps at that to save ourselves. Okay, so but there are some things that are happening within the country. Some of us know about the brain drain. Okay, but more more things are happening. They are not always in the news. They are not always displayed on the pages of newspapers. You may not find it every day in terms of the number of patients, for example, who has died in a particular hospital in a day and from what cause. So there are, of course, statistics about mortality, morbidity, but how much of this information are available and available on time for us to take action, whether action as a people, action as government, action as communities, action as families, action as religious bodies. We just need action. But if we don't realize that people are suffering, okay, that's not all the word to use. People are dealing with serious health challenges and they need help. Prevention is better and, in fact, less expensive, is cheaper than cure. Now, many times we see people coming with complications, not just symptoms, but symptoms that have progressed into complications for conditions that were actually preventable. Okay, so your doctor and I bring to you practical information and relatable discussions on health, lifestyle, wellness matters. Okay, so we need to get into this conversation. What are the things that are wrong? What are the things that are right with the health system in Nigeria? But you need to know that you have a responsibility as an individual to your own health. You are accountable to your own health. You need to be sure that you are giving yourself the needed care. You are giving yourself the needed commitment to taking care of yourself, taking responsibility, and giving yourself what you need. How much can you give if you are healed, if you are weak in any way, physically or even mentally? How much of productivity can uh, we get from you? All right. So your productivity is tied to your health. Your effectiveness in life is tied to your health. All right. So that's why they say health is wealth. All right. So let me know if you can hear me. I know that I have a number of people joining in. Please introduce yourself. Let's talk about the hidden health crisis, the challenges with Nigeria. So let me know in the chat if you can hear me. Where are you watching from? Kindly introduce yourself and then let's get to meet and let's get into this very important discussion. Please introduce yourself in the chat. Welcome to the live. We are talking health and not just a nation's health. We're talking about your health as an individual and how important it is for you to pay attention, pay attention to your health. Okay? The fact is that even though we have many doctors leaving the country every day, doctors are still in Nigeria, but the burden keeps increasing in terms of doctor to patient uh, ratio. You know, we talk about being supposed to be in the hundreds, but we talk about thousands now, thousands. A doctor to 10,000 of patients. You know, see the burden. So if you have ever been to whether it's a public hospital or even a private setup, you see the burden is reflected in the time that you spend in the hospital. Okay, you spend a lot of time because you have few doctors, even nurses, and other health professionals who are available to attend to patients. Okay, so if you have been there, let's know in the chat what has your experience been like. You know, talking about waiting time. A lot of people have to spend the whole day, and that's the fact. If you are going to any Nigerian hospital, except it's an emergency that, of course, you need to be seen immediately. Once it's a clinic consultation, you just have to be ready to spend the day there. Not because the hospital does not care or does not want to make it fast and easy, but of course, different conditions require different approaches, different time that will be spent by the doctor or other healthcare professionals in giving service to the patient. Okay, and then this differs for different people, different patients. Okay, so if you've been there and you know what it means to wait, you know, some people don't even find time to eat before getting to the hospital. And I've seen a number of patients who were already getting weak, getting to hypoglycemia, getting headache, and even feeling dizzy. You know, especially the elderly, and it's so painful, so sad to see some elderly ones coming to the hospital so early. They tend to skip breakfast. You know, some say because they feel they may need to do it, run a test that requires fasting. Okay, that's okay, but many times you see that some of them do not actually need to have such a test. And if you need to have such a test done, you know what you need to do is to talk to your nurse or the receptionist or whoever you can talk to about your being on a fast and the need to have a test done, because there are some tests. Of course, when you talk about fasting, you know, preferably you do as early as possible, 7 a.m., 8 a.m. Once it's moving to 9 a.m., may change the may affect the results. Okay, it may not give us a true reflection of the condition, ongoing condition, and the level of the parameters that we are checking. Talking about random blood sugar, I mean, instead of doing a fasting now, it becomes a random blood sugar check. Okay, so let me know in the chat if what your experience has been, what your experience has been like visiting the hospital. So, and I was trying to talk earlier I'm not sure if you were able to see, and I spoke about asking for people who are on medications, are they prescribed medications or are they over-the-counter medications? And the question is, why don't you take your medications? Welcome to the live. Kindly double tap on your screen to like the live, and let's know where you are watching from. I'm so glad to have you here. Okay, some people are popping in and out. Okay, so I wish you could just spend some time. Let's spend some time together to look at this and how it affects you. So the fact is that the hospitals are filled, full of people. When I say people, more of patients than the doctors or the providers of services. Okay, and there are many reasons why this is taking place. People talk about the level of commitment of the government to the healthcare system. Currently, there's a strike ongoing by National Association of Resident Doctors in Nigeria, and that's definitely affecting different things in the system. So let's talk about why people visit the hospital and what are the things that are really becoming more common when it comes to the people that come visiting. People come with different symptoms. People come presenting with a headache, which could be due to malaria. It may be due to hypertension. It may be due to stress. But that's why it's always good to see your doctor so that you don't just assume the reason for your headache. Some headaches may be due to a tumor in the brain, okay, and that's not something that you want to treat at all. So it's important to present to the hospital. Very important. It's critical. It's delay may be dangerous if you have a symptom that has especially even persisted, and you have not seen, even with your own home treatment, over-the-counter medications, you have not seen any improvement. So it's not something to overlook. It's not something to take for granted. A lot of people wait until it becomes an emergency before they present. For example, an individual may be having a headache as a sign or symptom of elevated blood pressure, severe hypertension. But if that blood pressure is not checked, if the individual who probably knew or didn't know that they had hypertension refuse to present to the hospital at the time that the headache is showing up, it may just lead to some other things like a stroke. So the individual can suffer a stroke, the individual can suffer a heart attack, and this, not just those two, other organs in the body like the kidneys may also be affected. So by the time such an individual is getting to the hospital, it becomes an emergency and requires more time, more attention. This is something that we see in the hospital at different times. Okay, so that's one of the reasons why I try to show up to encourage you, or to tell you to encourage others, to help people who need to know that prevention is better and it's cheaper than cure. So what are you going to do? What are you going to do with this information? I must let you know. There's something I must let you know. Okay. Like, share others. Okay, so I'm putting a question there. Like, have you liked the live? If you are yet to do so, kindly like the live. If you are yet to subscribe to the channel, please do so. If you want to know how to like the live, just double tap on your screen, and you will see the thumbs up increasing. As you do so, thank you. And then you can subscribe to the channel if you are yet to subscribe, and just be connected to the community, other members of the community. We want to welcome you, and we appreciate your presence. Okay, and we are here together to learn and to learn to live healthy. All right, so some people's names now, there's an increasing name. Let me talk about the increasing name. When it comes to hypertension, diabetes, they are more like household names now. Okay, it's more common than you think. Hypertension is more common than you think. At least 8 in 10 persons has hypertension. They have hypertension. 8 in 10 persons have hypertension. Okay, so that's a staggering statistics. Okay, and it's because we do not know, we are not actually doing research enough, and by the time we find out, just half of those who are hypertensive have been diagnosed, and of those who have been diagnosed, a little less than half have their blood pressure controlled. So these are staggering statistics. But the interesting thing is that these are preventable conditions. Okay. But the environment, the tension, the stress, whether you talk about nationally, whether you talk about in the communities, states, you talk about families, talk about individuals, going through stressful situations. These are things that may trigger these conditions. Interestingly, there are definitely the non-modifiable factors, and these are the family genetic factor. You know, there's a genetic factor to diabetes and hypertension, and then some other conditions. But these are common conditions that are preventable. There is the race factor. There is the age factor. Okay, with increasing age, there's a tendency to develop diabetes or hypertension. Okay, so that's why there is a need for action on your part as an individual. You need to take personal responsibility, to know what to do, and not just to know, but to do. Not just to do, to be doing. That's actually the important aspect of it. When it comes to lifestyle changes, when it comes to diet, exercising, which what needs to really be done is that need for consistency, and that's one of the characteristics that helps that differentiates between someone that has a good management of their blood pressure or diabetes, and another that does not have good control. Of course, there are many factors. So hypertension and diabetes are actually becoming family names. Okay, names. If somebody knows somebody that has hypertension in the family, somebody knows a friend, a colleague, probably developed a complication, a stroke from hypertension. Okay, beyond just these conditions are the complications, and these complications, talk about looking at it from the head, to the toes. Stroke is a common thing, stroke, and some weeks ago, some days ago, World Stroke Day was celebrated, and it's about knowing that every minute counts, when a stroke event happens. But there is also the fact that every minute counts for every day that you live, the way you live, what you do, how you do. These are things that you need to note. For example, some people don't know that the number of hours that you sleep really counts when it comes to how your health moves, how you're able to have control of your blood pressure. So if you don't sleep well, you can have poor control of your blood pressure. Some people, their trigger for hypertension was just insomnia, the fact that they couldn't get to sleep. But before they got to that point, there was probably a habit of not sleeping early enough, an unhealthy attitude to sleep. Okay, so but you know that you should, as an adult, have at least 6 hours of night sleep, and that should be restful. That should be something that rejuvenates, that helps your body to renew, and you are re-energized. You are strong to take the day, and that's very important. All right, so people think that it's just something that happens to the elderly. you know it's no more a thing or a matter of the older age group. Hypertension is now showing up in the younger age groups, diabetes showing up in younger age groups. And that's not far-fetched. The reasons are not far-fetched. That's because apart from the genetic factor, there is the lifestyle factor. That's talking about the modifiable life. People uh, take alcohol without control. People smoke. People have sedentary lifestyle. So, and at that point, ordering of foods, fries, fast foods, laden fried foods, these are unhealthy ways to live. Okay, so the fact that people become overweight, obese, these are risk factors, in fact, independent risk factors for cardiovascular diseases. And so there are certain things that you can be doing, I rather put it that way, that you are doing to ensure that you save yourself, you prevent having diabetes or hypertension. And if you have already, you know you should have a proper evaluation by a doctor and then a plan for management. Interestingly, there is the possibility of reversal reversal of high level of blood sugar, or even high blood pressure. Okay, and if there's a bit of attention, I'll use the word, if you are intentional and intensive with your management or lifestyle changes, you can have a reversal of high blood sugar or high blood pressure. And there are other things happening, maternal deaths, people are having mental health issues, mental breakdown, stress related illnesses, becoming more common. So people are working, keep working without taking a break, and that's not healthy. Even as your doctor, as a family physician, I understand I have a lot to do. I have demands here and there, but I try to take it easy myself and find time to rest. Sometimes I take a break from YouTube. So you can see practically why it's important. And one day I'm going to tell you what happened when I had elevated blood pressure and what I did. Okay, I'm sure you will be interested in knowing that. All right, so people in their 30s, people in their 40s are now being diagnosed of hypertension or diabetes. So the health system is actually stressed. Talking about the numbers that I mentioned earlier, a lot of healthcare professionals have jackpot. The jackpot syndrome is still existing. Okay, so you need to know this as an individual. And so that's why it's important to uh, be more intentional with your preventive measures, taking steps to prevent unpleasant medical conditions rather than developing these conditions and looking for ways to manage them. So, as I was saying, our lifestyles have changed. Okay, our lifestyles have changed. People are now into eating breakfast, skipping breakfast, which is not healthy, and that triggers ulcer for some people. Peptic ulcer disease is also common, and then there's a genetic factor, but there's also a lifestyle factor. Skipping breakfast, especially after fasting for hours over the night, and then by the time somebody is taking what looks like breakfast around 12 p.m., they're either probably taking a snack, a soda, and this worsens ulcer pain and the symptoms. So, what else? There are other things like the sedentary lifestyle during the day, throughout the day. People are not intentional about exercising, and then eating late. People go out. Some people may be on their way to work right now. You know, or people left very early. There are people that will also likely come back late in the night, and so probably they skip breakfast, they eat late, brunch or lunch, and then eat dinner late at night. So if you are eating your dinner 8 p.m., 9 p.m., 10 p.m., some people even eat 11 p.m. Some people are proud to say they eat around 12 a.m. That's not healthy at all. Okay, so it takes a lot of work on your body or your system to process these foods, and especially if you decide to take swallow, and that can do so much more damage to your body. So the reason why people are adding unnecessary weight, people are developing diabetes, and the fact that sleep pattern is not good enough, they also develop hypertension. All right. So what's else? People are getting worried. Worry, news here and there, tension here and there, fear being spread in different ways, in different places, especially on social media. Okay, so you have a responsibility to watch what you watch, to determine what you read, what you listen to. Okay, and because all those things affect your mental health, you get to see more violent events, violent scenes, and then your brain your mind is filled with those things and brings some tension on your mind or your mental health. So you need to safeguard yourself. You need to watch. You need to worry less and trust God more. All right. So that's one thing I will advise you. You need to worry less and trust God more. People pray, very good to pray, and I believe in the power of God, the power of prayer. Okay, but when you need to seek medical attention and you're spending all the time praying, then that's something you are doing wrong. Okay, if you take the right step and you pray, very good. All right. For example, somebody may choose not to take their drugs, even when the fact is there that the drugs have been helping to control their blood pressure or even their blood sugar. So if the person decides not to take without a clear evidence of good control over the years, then that may be danger. So what else should we be talking about? Nigeria's hidden health crisis. They are not just a national thing I'm describing. There are things happening within families in the lives of individuals that are not being reported. Okay, and then the fact is that doctors and nurses are leaving numbers. I know you know. Hospitals are losing equipment, maintenance, challenges with equipment. Of course, there are certain places, centers in Nigeria that you have very good equipment and, of course, professionals available, but the pressure is much. So, with all these challenges, increasing cost of medications, some pharmaceutical companies uh, pulling out, breaking down. People are frustrated. Some people decide to go for alternatives, go for traditional treatments, which may come with different complications over time. People self-medicate, people use over-the-counter medications, and that could do a lot damage to the liver. People have been taking so much of analgesics, treating pain, when they should actually visit the hospital to be seen appropriately by a doctor. So these are some of the things, consequences of the brain drain. Okay, people don't want to go to sit in the hospital waiting. So people rely on herbal medications, unverified drugs, different supplements, and these are not things that have been confirmed to be effective or even particularly applicable for your own health. But here's the truth: the health system can only improve when you and I, when we become proactive. You don't wait for sickness, you don't wait for symptoms before you do a checkup. So you need to get your screening done regularly, your blood pressure, your blood sugar. You need to monitor your weight. So when we move from just trying to handle symptoms and complications to being proactive in the preventative mode, then that will help not just you as an individual, to help families, communities, and the nation as a whole. I believe in Nigeria. I believe in the strength that we have in faith, spirituality, in family system, in communities. There's that strong connection. We need to maximize this. We have many churches, we have different religious bodies. People pray, but I also appreciate the fact that there are places where people are also being screened. There are places where people receive lectures, health related seminars, even within churches, within communities. that that's targeted at the people, helping the people, preventing and creating awareness about certain conditions. So people have opportunities for screening, and that's the way some people got to know that they have hypertension. That's the way some people get to know they have diabetes. So, and with that, a lot of interventions have been applied so that people will not develop complications. Mosques can also host wellness days, specific days. Families can start monthly health checks on a particular day. When one person becomes healthier, it affects not just the family, affects the community, affects the nation as a whole. And that's how we build the nation from inside out. That's how we grow as a country. Okay. Uh, the crisis, the experiences, they don't have to be permanent. We can take control. We can handle this. We can do better. We can be intentional with our habits. The question I asked now, do you know about taking fruits and drinking water? How well do you take fruits? How much water do you drink? That's just those are examples of what you need to do. I believe somebody somewhere got some motivation, some understanding of the health crisis in Nigeria. It's hidden, but it's actually open. As a doctor, I get to see a lot, and many of my colleagues have experiences that they may not be able to share, the opportunity to share. But things happen in the hospital setting. We see a lot of people with conditions that are not well managed, that have not been well managed, and maybe some other challenges with finances that people are not able to get medications, do necessary tests, I mean, to as part of their checkup or follow up, and this affects their health a lot. So, what are you going to do about this? What are you going to be doing differently? Of course, the communities, the leaders, non governmental organizations, the government, and there's a need to take responsibility. There's a need to do the needful. Okay, as long as we keep denying, as long as we do not show commitment, we're not willing to really do what is needful for the people, then we are not showing true leadership. The government is not doing what is right. So, what is your own role? What are you going to be doing? For me, for example, I'm doing this to bring awareness, doing this to help you to understand what is happening, doing this to help you to take a decision on how to handle your own health. Prevention is better and cheaper than cure. All right, so I also give my best when I have patients that I need to treat, offer them the best in terms of clinical service, and trust God for more wisdom, more grace to do my part. Thank you for tuning in. Thank you for watching. Okay, so we can get to meet now. If you are yet to introduce yourself and you are here, thank you. Okay, so let's come on. Who is here? Who has been watching? Who has been listening? Let's know in the chat. Just introduce yourself, okay? So, what do you have to say about these things? If you have any comments, any observation, or you have a question, Andy. hidden health crisis in Nigeria. I know that most of my people in the United States are deep into the night. It should be around 2 a.m. And then West African side, for it's early morning, people have different things they are engaged in. But if you are here, let me just know that you are able to watch and join this live. Where are you watching from? I believe you can hear me. Let's see what we can do more in 15 minutes or less.